to do on a clinical day. The day before your clinical, you go to the hospital to receive your assigned patient. You look up your patient's admitting diagnoses, previous medical history, history of present illness, medications, and current status. You look up all the medications that you will be giving to your patient. Make sure to note the therapeutic actions, contraindications, and adverse effects of each drug. After finishing your clinical prep, get a good night's rest. Nursing students wake up early in the morning. We need to be our best, so eating a good breakfast is an important part of a successful clinical day. You will arrive on the clinical floor no later than 6:45 a.m. First up, you listen to reports from the healthcare team on updates about your patient. Then you hit the floor running. You go into your patient's room and introduce yourself. Take their vital signs: blood pressure, temperature, respiratory rate, heart rate, and O2 stats. Ask your patient if they are having any pain, and if so, report it to your assigned RN. You perform physical assessments, but don't worry, your clinical instructor or RN will be there to support you if you need help. You will chart their vital signs and assessment on the patient's chart in Epic and check to see if there are new orders for your patient. You go over all medications with your instructor or RN before giving them to your patients. You always want to make sure to update your co-assigned nurse about which medications you will be giving. Ask your patients if they would like to take a bath. If so, get linen to help bathe them and help change their linens. When breakfast comes around, help patients in eating. Also make sure you keep their room nice and tidy. As the clinical day progresses, you might administer more medications with the instructor or RN's help. Be sure to chart medications and to look and see if there are any new lab results for your patient in the computer system. Finally, lunch. Take this time to relax before rounding up your day. When you get back to the floor, look at Epic to see if your patient has any medications due and administer these medications. Encourage your patient to get out of bed and walk in the hallway if possible. Getting them up and out of bed as soon as possible will help expedite their recovery. Once your work is finished on the floor, you will have post-conference with your clinical group to talk about the day. Before you know it, the day is done. Time to go home and write that clinical log and, of course, relax.